bedside. So first off, you'll need a cannula. They come in a number of sizes, and the sizes are always color coded. You will need to make yourself familiar with the cannula that are in your ward. Today we are going to use this cannula. You'll need a tourniquet. You'll need alcohol swabs to sterilize the skin. You'll need a little bung to put in the drip once it has been inserted. And we'll also require a dressing to hold the intravenous cannula in place once you have inserted it. Local anesthetic and a small syringe with a very small needle are also needed for putting in your cannula. So now, with everything in the tray, you're ready to go to the bedside and insert the cannula into your patient. Hi, well here we are at the bedside, and we're going to go ahead and put an intravenous cannula into one of the veins in this gentleman's arm. Before we go anywhere near the patient, we're going to get all our gear set up ready to go. You may well have the luxury of a nurse helping you, but most times you could well be doing this procedure entirely on your own, so you do need to be set up. And that involves taking the gear that we bought in this little container and having it spread out ready to go. So the dressing you need to open and have ready. The little alcohol swabs that you're going to clean the skin with, have at least one of them open and out so that you can pick it up easily, and the other two are in reserve. You'll need your local anesthetic, and that needs to be from the ampule. You take the top off the ampule, you take the syringe out of its packet, and sterilely you put a little bit of local into the syringe. You make sure that that needle stays sterile by inserting it back into the little cap, and it's then ready for you when you need it. Finally, you need to open up your cannula. Slide the sterile cover off. Keeping this sterile, just make sure that it's going to advance off the metal stellette. And then you can put it back inside there, lay it down, and it's ready for your use. And finally, the bung that you're going to put on the end of the drip, once it's in place, needs to be taken out of its little plastic container and gently freed up and then placed ready to be used. So we're now ready to go looking for a vein. At this stage, we're ready to insert the intravenous cannula. Put on some rubber gloves for your own protection. We use a tourniquet to distend the veins, and I place the tourniquet high on the arm and pull it firmly closed. That allows me to see the antecubital fossa, the forearm, and the dorsum of the hand, all areas which could provide suitable veins for your cannulation. I then put the arm over to the side, or be around the bed, and you can use gentle tapping or the patient squeezing your fingers to help with the distension of the vein. With this particular patient, who is quite hairy, we're going to shave a small area around the vein we've selected. That will make it easier to visualize the vein, and will also make it more comfortable for him when we take the sticky dressing off when the drip comes out. Okay, so we've selected this vein to put the intravenous cannula into. The advantage of this site over the antecubital fossa and the back of the hand is that you can move the wrist and the elbow without kinking off the cannula once it's in place. We've shaved this area, and so there's a nice clean area, and we're now going to rub that area down with a little bit of alcohol on a swab to make sure it's clean and sterile. We then put a little bleb of local, this is the local, in a syringe with a very fine needle, and that's going to go in over the top of the vein right There, little sting, little bleb, and you can see that little white area, which is a little deposit of local anesthetic. Okay, so you place your needle safely inside its little cover here, pick up the cannula, shake off its cover, steady the vein by pulling down on the wrist. There's your little bleb of local. There's your vein that you can feel, and always remember it's the vein you can feel rather than the one you can see, and through and in. And you'll see we've got a little flashback of blood here, which shows we're in the vein, and we're then going to just gently advance the cannula and release the tourniquet. So now we have the cannula inside the vein, and it's ready to be secured and the end to be bunged off with this special bung. We'll go ahead and put the securing tape on even before you take this out, because what you don't want to do is to have that cannula fall out. At this stage we can now occlude the vein above the cannula, pull that needle out and screw the bung on. I take my finger off for an instant and I see that there's blood flowing back, so I know that the cannula is where I want it to be. And from now on in, it's just a matter of securing it firmly, which we do with the dressing that you've already had ready to go. We use these split dressings. They go on either side of the cannula, and they have a clear area above so that you can actually see the vein where the cannula is running. Once that's in, peel this little bit of paper off and you're set to go. Having secured the line, flush the blood out with a little bit of normal saline that you've drawn up. The patient is obviously comfortable, and make sure that you get rid of your sharps into this container, which can then be taken to a proper sharps container. So there we are, a simple procedure, and your chances of success will be greatly increased if you make sure that your patient's relaxed, that you are relaxed, that you are well prepared before you even approach the patient, and then I think you'll find that putting in veins becomes a very pleasurable experience for all concerned.